I took testosterone for a year of my life to try to be the opposite sex. 2 years ago, I was a healthy, skinny, and beautiful girl in my late teens. But after taking testosterone for a year, I turned into an overweight, pre diabetic nightmare of a transgender man. I'm one of many young women that have been failed by the medical system. I was treated with mega doses of powerful testosterone, and it ravaged my body, causing me to gain 50 pounds, and it put me at risk for a heart attack, heart disease, diabetes, teenage menopause. And all of these were regretful choices I made as a teenager, but I trusted the doctor's advice.
15 months on hormone blockers. Yep, that's how long I have been on blockers. But in medical terms, they haven't really been around for that long. The only thing that they do know for definitely is that they stop puberty. The NHS know absolutely nothing about blockers.
It's such a serious process to go down, and it's so experimental because doctors don't even know, the outcomes of a lot of these treatments.
This entire approach runs contrary to how we practice medicine in every other area. So if we're going to go down that treatment protocol, there better be very good evidence that it works. And that evidence does not exist.
The surgical and hormonal treatments now being proffered for gender identity disorders are experimental procedures. They are not evidence-based procedures.
There just isn't a lot of evidence-based medicine for which to support the interventions that we're offering these families.
We don't know long-term outcomes, but it hasn't been tested from childhood forward. Medications are being used off-label without proper FDA risk assessment profile. The quality of evidence, if you look at the Endocrine Society's own guidelines on this for children and adolescents, it says right in there, it's low to very low quality evidence. This whole thing is an experiment on children.
We don't know with regard to some of the long-term consequences of these medications. I mean, if you look at our consent forms, they're fraught with vague language and may, could. We know very little about things that are really important to families, like fertility, like cancer potential or oncologic potential of these agents, cardiac risk. I mean, things that are families want to know.
Therapy for young children that encourages transition cannot be considered to be neutral, but instead an experimental procedure that has a high likelihood of changing the life path of the child with potential effects on mental and physical health, suicidality, and life expectancy.
Unstudied, unproven, very dangerous. You're supposed to do the experiments first, show that the treatment works, especially when you're talking about infertility and sexual dysfunction long term, and a four-fold, a 4 times increased risk of heart disease and a 2 to 3 times increased rate of development of blood clots and strokes. And the data we have now shows a 20-fold increased risk of suicide long term.
This is a massive social and medical experiment that is completely unregulated, and it's also not fully consented. This is a massive breach of medical ethics.
I'll never forget the conversation. He was actually the nicest, the last attorney that I talked to was the nicest attorney that I talked to. He said, Scott, trans health is experimental. So what you had done to you was experimental. Doing a medical malpractice case on any type of medical transition requires that there needs to be a baseline for care. There is no baseline.
When my voice started to change, I was elated. When I got top surgery, I was elated. And so naturally, because I was elated after each step, I thought, that meant that I was going in the right direction. But when it was finished, I was left incomplete, broken. I couldn't even say the words, I regret my transition. I couldn't bear to hear myself say it. It was the unthinkable. It was my greatest nightmare.
After almost 5 years on testosterone, I started to experience liver and kidney failure. However, I was not prepared or told even that kidney and liver damage could be related to cross-sex hormones.